studies how we have like the vitalists who are like just really old school.
Okay.
And then the rest of us.
Yeah. All right, interesting.
So.
Okay.
So yeah, I had adjustments, exercises, stretches, and some soft tissue work.
Okay. And how old were you? Like, were you like undergrad when you met
16.
the? Okay.
Oh, the ND or the
yes.
the
ND.
Yeah, it was 17.
Okay. So you met the ND. Was it because of the chiropractor like referred you or?
No, I was in undergrad and like my plan was to get a chiropractic degree after, and then also get acupuncture training, herbal training, homeopathic stuff.
Okay.
So like I didn't know that something had all this together yet.
Okay.
So yeah, no, I was literally halfway across the ocean where I met ND. So.
Very cool. And so your like initial thoughts on that were just like, oh, this is like pretty cool or something like that?
Yeah, like I didn't have a concept of it being everything put together with a coherent philosophy until I talked to it, because it wasn't really spelled out in that book. In the book, it's like a phone book of everything you could think of and more, all different types of body work and lots of different healing traditions in there.
Okay.
So it wasn't really spelled out that actually this is kind of like the gatekeeper to other holistic therapies, almost like the PCP of holistic medicine.
Okay.
So.
All right, interesting. Thank you so much for that. You feel that's pretty all right for that question?
I hope so.
Yeah, yeah.
Whatever you're trying to produce.
Yeah, it covers everything there. All right. So for the next question, do you believe that there are moral differences between Eastern and Western medicine?
So yeah, that's what I was asking about this paper. Like, this isn't a philosophy class. I don't know how deep
No.
you want to go with.
No, that's nothing too deep. I'm just trying to get some base level stuff.
I wouldn't say that one is necessarily more just than another. I think there's a greater opportunity for health equity and justice through naturopathic medicine. But we're in an unjust economic and governmental system, so that even though we're literally using stuff that grows out of the ground at our hands, it's less accessible than a $4 pharmaceutical.
Yes.
And a doctor you can find on, or PA or NP that you can find on any corner who will prescribe it. So in a sense, there's I guess the question looking at the heart of the medicine itself, and then access, and then practice, right? So I guess one angle of addressing moral questions is capacity for justice. So I would say that there's less of a tendency for NDs to write off patients and complaints that are not understood within the conventional paradigm. Mm-hmm. So there's a greater understanding, there's a greater acceptance of range of experience and diseases, I guess. I will say though that there's some issues with how things, specific origins of naturopathic medicine. Some of our founders were kind of ran in the early Christian Science circles in the early 1900s. There's some flavors early on in some of Lindlar's writings of medical eugenics, mm-hmm. which is a problem that I think we have not properly owned up to collectively as a profession. And there are flavors of that have kind of come through in the pandemic. There's
yes.
There are self-reliance because there's a lot of heavy capitalist kind of profiteering off of the individualism that is so big within the larger wellness industry that basically says you have all the health you need inside, you just need to do the right things to unlock it. And if
Okay.
you're not healthy, it implies that that's your fault.
Yeah, that you personally are at fault for that.
And that implies a very, very strong, if you want to go to the philosophy rabbit hole, very strong sense of free will. And also completely ignores the larger oppressive systems that prevent people from, like I said, accessing things that might help them feel better, the knowledge to do so, that many of these cultural practices that comprise naturopathic medicine have been stripped from cultures around the world. So there's a bit of irony in practicing a system of medicine that borrows from cultures around the world and that is best developed and practiced in the United States and Canada.
Yeah.
Which both have a history of cultural genocide. So
Okay.
that's a lot of answers to.
Oh, that's perfect.
to
No,
your
that's honestly
question.
perfect.
So we've, very specifically, I have enormous bones to pick with members of our community that have hyper-focused on the individual side of a transmissible disease that involves all of us, and our collective behavior has determined that we've failed in our response. And that they've created a false dichotomy of don't wear a mask, just eat vegetables.
Yep, yeah,
and buy my
I've seen that.
supplements.
Yep.
And becoming healthier and working on chronic things that increase your risk of severity of COVID and basic public health measures are not mutually exclusive. And they've created a dichotomy that one is oppression and the other is liberation.
Yeah. Yeah, that's become very clear with all of this.
And it's a really good chunk of us, and sadly it's the loudest of us, because the loudest of us have gotten where they are by being contrarian. That's the brand.
Yeah.
So even just saying alternative medicine inherently defines it as being as contrary to the conventional system.
Yeah.
And it's not. It doesn't have to be. And so so when you say like Eastern versus Western, it's kind of a geographical thing or a lineage. We are the bridge profession, because I can legally in Arizona, I can inject corticosteroids, I can inject PRP, I can write a prescription for testosterone, or I can give you an herbal tincture.
Yeah.
I can play with both hands.
Okay.
So in a sense, like, we are the bridge, and I think that makes this conversation more interesting than
Yeah.
literally like alternative or holistic versus
Okay.
allopathic. So
All right. That's super.
little differences, yes, but it's not as easy as one is more or less moral than the other. There's different axes to look at this.
Yes. Yeah, I definitely know what you mean with the whole pandemic thing, because you can see people are either like fully on the left or fully on the right with things. Like, it's just, yeah. And I've gotten
You
some
can do
stuff
both,
here and
yeah.
there. Yeah. Yeah.
And who's getting behind, who I care about, are those most at risk, those with the least tools and access to resist becoming infected, and who stand to lose the most.
Yes.
Disabled people with severe chronic conditions that now no one is protecting them anymore,
Yeah.
including our CDC.
Yeah. Because right now, my mom and my younger brother are like immunocompromised. They have some issues here and there. And some of the things I've heard people say just about those who do have issues like that is just, it's like, oh, well, if you eat this, then it's, yeah.
I wish it was that easy.
Yeah.
I'm an ND.
Yeah, exactly.
I wish I could tell people to eat broccoli and then they just would never die.
Yeah.
It ain't that easy.
Yeah.
It's, um, yeah, it's just frustrating.
Just
And
people
I think a lot of them don't really believe it. They're just
dismissive.
getting the followers and they're just trying to get patients and just trying to sell their damn supplements.
Oh, yeah.
And that's a moral issue more than knowing you're wrong. And knowing
Yeah.
you're wrong and worrying about something and doing it is worse than being ignorant.
Yeah. Yeah, exactly so. Thank you for that. That's awesome.
Yeah. So I guess I kind of dipped into the next question.
No, you're fine. You're fine.
Methods of treatment. Well, like I said, if you're talking about holistic therapies or alternative therapies or vitalistic therapies, if you will, traditional stuff, I'd say their methods of analysis and treatment differ, and they're all different. So a chiropractor is going to have a completely different assessment from a homeopath or from an Ayurvedic practitioner in India, or a Chinese medicine practitioner. They're going to have a totally different system of analysis and therefore treatment. There are some commonalities. There's traditional bone setters in cultures around the world going back hundreds and thousands of years. So, chiros were not the first ones to do bone setting, or osteopaths. But in general, these other systems, including naturopathic medicine, are more focused on balancing and supporting the body, mind, maybe spirit, depending on the system. Whereas Western medicine is focused on a biochemical, structural reductionist mindset, that the more micro we go in our knowledge, the more specifically we can treat. So in a sense, I think the separation between these things is artificial because we're doing the same thing with nutritional biochemistry and some, like I was saying, PRP and some of the new cellular therapies. One difference would be more so that we are not looking at kind of the one part of a pathway or a bacteria that we're trying to block function of. In general, our therapies are about harnessing and boosting the self-healing power of people
Yes.
through multiple pathways.
Okay. So yeah, it's
Rather
just
than a single enzyme we're trying to target
Yeah.
that will then fix your problem. I wouldn't say, MDs I don't think consider themselves non-preventative. I think it's just a different degree of prevention they
yes.
are practicing. So I think the longer we go, the more detailed the old school holistic stuff gets, the more pinpoint it gets. And ironically, the conventional system is realizing that more and more conditions are multifactorial and giving multiple treatments to address different angles of it. So I think the longer we go, the more these two things look similar.
Okay. So you're pretty much saying that at a point these two might kind of merge a little more, or do you think that they've merged more in the past couple years?
Yeah, and I think that's part of that's just the march of science.
Yes.
Because there's a lot of questions about how XYZ works. And a lot of the research has shifted from does chiropractic work to how specifically does it work? What are the mechanisms? So, yeah, say you could pick examples both ways, but I would say there's kind of a convergence, and you're seeing even within the AT Still PA program, they have a focus, even if it's mostly a name only, of body, mind, spirit. And they have a class, and we guest lecture in the class. They refer to physiotherapy instead of just surgery now. Like, things are changing on the conventional side, but they're still constrained by their larger system of insurance reimbursement. And,
Okay.
still take the ibuprofen, but also physio. But we're only doing physio because you have to do that, or insurance won't cover the surgery. There's some forcing of things, but they are becoming, to the extent that they can structurally, I would say they're slowly becoming a bit more holistic.
Okay. Very interesting. Because I have noticed recently, just with people's outlooks, especially in this area, because I'm from like mid Ohio, and it's kind of honky tonk, kind of cornfields, and it's pretty much the demographic here. But yeah, I have seen a good switch.
But you know, one of the things that's interesting with this whole political shift the last like 7 years or so is it used to be more so that like natural medicine was kind of the realm of like, you know, the leftist hippie.
Yeah.
Like, you know, 60s sexual revolution, drugs, all that, you know, communes, all that stuff.
Yeah.
But it's not anymore. It's kind of come full circle, and I think that's part of what's shifting like some of the wellness influencers to hard right, if not alt right, in a sense. Is there's this like no one can tell me what to do. This kind of libertarian mindset that's like has enveloped their concept of Western medicine as like, oh, these elitist doctors that hide behind their prescription pad, blah blah blah. I can take care of myself. I can eat better and blah blah blah. So I don't need that damn vaccine.
Yeah, I've heard plenty of that.
And it's like so this everything's come full circle. So ironically, a lot of like the health freedom movement is mostly hard right now, and it used to be more left, more kind of like liberation from the medical system, and now it's more just kind of anti the medical system.
Yeah.
I'm just angry about everything. So.
Okay, that's cool that someone else has noticed that too, because especially with the whole vaccination thing, it flipped like almost instantaneously how the entire just whole aspect just like horseshoed.
I think a lot of it had to do with just political affiliation.
Oh yeah.
Sadly, that was my prediction early on. Like literally the timing of who was president when the pandemic came had everything to do with our response. And I don't literally just mean like the choices that the Trump administration made, but by virtue of the timing of it during an election year, the timing of if things went well or not well with whoever was in power, there would be one side pushing against whatever was going on.
Yes.
Because our moments of national unity have never lasted long. But
you can say that again.
Quick note, by the way, where are you in Ohio? Like roughly?
I am in.
Really good. If you're looking for shadowing opportunities, I know a really good classmate of mine that would be.
Ooh, okay.
If you're looking.
All right.
He's in Toledo, and I don't know Ohio.
Yeah, yeah, you're good. I am in.
That's remotely close. You're like.
Yeah, I am currently in Findlay. That's like an hour north of me, I believe.
Let me know.
Okay.
Drop her a line.
All right.
Aaliyah.
Let me write this down.
Aaliyah Watts. More. She got married.
Okay.
I think she was by Aaliyah Moore, Dr.
Yeah, because I originally grew up in Mansfield. Because it's like north mid.
Waterville, so it's even closer.
Oh, interesting. Okay.
Toledo naturopathic.
Oh, I'm having to take that 2 semesters? Yeah.
It's good. It'll prepare you.
Let's hope so.
It goes fast.
It does.
School.
It's
It's more detailed in
very
school,
fast.
but I mean, in med school. But yeah, Emily is awesome.
okay. All right, I have her name down, and I'll ask about her in case, because I kind of, sort of have one arranged.
Who is it?
What is her name? Nicole. She's an Amish lady that we know, and then she's licensed. I think she went to school in Florida.
Naturopath?
Yeah. She got her titles in Florida.
Okay.
Yeah. I don't know what university here. Let me see this actually.
It's not a university.
Yeah. I did some research into it. I'm like, somewhere in Florida? I can't find anywhere.
This is the problem with unlicensed states. So when I said that North American naturopathic physicians, which is a protected title, are physician trained, it's only the CNME accredited schools.
Yes.
Everyone else is a naturopath or traditional naturopath, and our lineage divides, well, technically in the 80s, but really a lot before that. So our lineage goes back to the supporters, like Lust, for instance, had a 4-year naturopathic medical school since the early 1900s. It's just a different model from the rest of them who are not, many of them just have like an online quick training.
Yeah, just like a certificate or something like that.
The training is entirely different.
Okay.
So I can't speak either way to each particular person, but there's a ton of variance. Because there are actually a couple programs that are closer to what we do, but the confusion in an unlicensed state like Ohio is that you could call yourself a naturopath. You could.
Yeah.
There's zero title protection. So that experience that you have, I would do it. It'd be awesome.
Mm-hmm.
But keep in mind that she's likely to be on a totally different plane than what you will become as a graduate of a CNME school, even if you're practicing, so to speak, in Ohio. So Dr. Watts / Mortimer, I guess professionally she's still going by Dr. Watts, would be really good to talk to about that, at least because how she's practicing, so to speak, in a pre-licensed state looks different from what I can do. So I'm talking about injecting stem cells and PRP and all that stuff. That's not happening in Ohio.
Yeah.
So unless you get a PA and get functional medicine training or whatever, but yeah.
Okay. Because
every pre-ND student that I've talked to in the Midwest has had some shadowing set up with naturopath non-physicians, and it's a different world.
Okay. Because she has the titles. She has ND. She has aromatherapist, biblical medicine.
For that.
Okay.
So you can do a weekend program and say you have an ND.
Oh, that's okay.
It's not federally protected. I mean, that's true for PhDs too. There are online fake PhD programs too.
Okay.
And you can't tell that from a more intensive program from an actual CNME accredited program because it's not, in the state of Ohio, it's not protected. You can put like any letters after your name.
Okay.
So.
Yeah, she has a ton of titles, which was kind of my first red flag.
Yeah. There are very few legit people with a lot of titles.
Yeah. And most of it's
Alex
like
Vasquez is a DC NDDO and he's just been in school forever. He has all these degrees.
Jeez.
And writes amazing books. But there are few NDMDs or NDDOs or it's more NDDCs, but you just can't tell outside of the licensed states who's legitimately has a license to practice naturopathic medicine.
Okay. Yeah, because it just says that she's licensed to practice, which I did kind of keep the Ohio thing in the back of my mind, but I wasn't.
That's not where you want to end up?
No. Oh, no.
Oh, okay. Well,
Yeah. Yeah, I'm getting tired of bipolar weather here.
Where do you want to end up?
Preferably Arizona, because I have visited there before, and I feel like a lizard. I vibe more in just warmer weather, just really dry.
Well, that's...
Yeah, that's pretty much where you'd want to go.
That's it.
Yeah.
It's either here or, like, San Diego, maybe.
Mm-hmm. Yeah, and I have some family in Bullhead. Bullhead?
Okay.
I think that's what it's called, yeah. Yeah, this place is horrible.
Accurate, and also, if you just think, would that make sense in Arizona? Yes, it would.
Yes, it would.
It's kind of a weird place here.
Yeah, it was...
there's tons of indecent shadow here. But,
yeah.
Dr. Watts did start here. Did preceptorship with actually the previous executive director of Naturopathic Worms.
Ooh, okay. Very.
So,
What kind of shadowing experience did you have? Just out of curiosity.
I actually worked with Andy in Hawaii, and that was actually it.
Mm-hmm.
But I worked for him for like 2 years, so
Okay.
on and off.
So was it like an internship sort of thing, or?
At first, I was just helping him with some things and shadowing a little bit, and then I actually worked for him. He had kind of a supplement shop with office in the back, so open to the public, but also he saw patients, so I was kind of his front desk / like supplement store guy.
Mm-hmm.
And
Okay.
then went to see him.
Cool. So, like, at what age did you go to SCNM? Just out of general curiosity. Did you go
21.
like? Okay. Very cool.
I skipped a grade in school. It's kind of a long story. So I graduated college a weekend of my 21st birthday. And then did my first global health volunteering in Mexico that summer, and then went to CNET.
Okay. Very, very cool. So what did you major in for undergrad?
Psychology.
Okay. Yeah, because I'm in bio right now, and it's kind of slaughter. Just a little bit, but...
I mean, get your prerequisites, get decent grades, and then focus on what you want to do to become the physician you want to be.
Mm-hmm. Yeah, so far I'm kind of leading towards the side of, like, endocrinology.
Which piece, like hormones or
more on the
diabetes
hormone side.
Okay. A lot of that down here we can prescribe. So a lot of hormone replacement and naturally balancing through liver processing and stuff like that.
Yeah. Right now I'm reading a book by Alan Christensen. Yeah.
So he was in the first class at SCNN?
Yes. Yeah, I've talked to him a couple times here and there, but I'm in like the middle or so of this book. It's interesting stuff. So.
The adrenal reset.
The what is it called? It's the one after that. I can't think of it. That's gonna drive me nuts.
Thyroid or.
It's gonna drive me absolutely insane. What is it? Come on, phone. Metabolism reset.
Oh, yeah.
Yes.
He's pretty anti-homeopathy.
I did not know that. Okay.
Oh, you will soon enough.
Yeah,
I've been
yeah.
talking to him.
Okay.
He's trying to get it out of the profession entirely.
Just homeopathy, period? Huh. What's the reason for that?
He thinks it's not only bullshit, but also the thing holding us back from acceptance.
Mm-hmm.
So there's kind of hinted at like some different wings within the profession. Like there's the vitalists, and then there's I don't want to create a weird dichotomy. Like they create this dichotomy that you're like either a vitalist or you're not a naturopath, which is just bullshit. There's flavors of us. The vitalist community itself has kind of fallen into a lot of this like COVID denialism stuff, but also has not been on the right side of kind of the racial reckoning happening in the profession too. So I don't have a lot of. I've lost increasingly respect for the group of vitalists collectively. So I'm with Alan Christensen on that, but I don't think that cutting ourselves down is the solution.
Yeah.
So I agree with the vitalists, the old school docs on that. I don't think scope restriction gets us anywhere. But I have a lot of respect for him. It just he's kind of mentoring this group of students that's trying to like kneecap homeopathy within the schools, and it's really
yeah.
annoying for one thing because students don't know any better. Like
Yeah.
the things that I'm speaking to, like these much larger historical things, are not even well understood by most NDs, and students are really moldable because they're just kind of learning as they go, and there's
Just
a
absorbing what
ton
they
of
have
stuff
to.
to know about, and these different factions and how things have changed over time, and to just have a strong personality, be like, we need to completely remove one modality before you've really experienced it and taken your own trip through the research, and it's just a little premature, I think.
Okay.
So I encourage people to get a variety of, like, go work with the Amish lady, go work with Dr. Watts, and like get a ton of experience and decide, like I said, who's the physician you want to be.
Okay. Yeah, just accumulate different just sources and just kind of weed out. Is what, based on morals, pretty much?
Well, I mean, primarily based on efficacy. Mm-hmm. It's not like there's nothing to the vitalists. I have issues with the dogma of them, but a lot of what I do looks a lot like what they do. Mm-hmm. But I'm also anti-racist.
Oh, that's good. That's good to hear.
And I also don't shun medications.
Yeah.
It's another tool in my toolbox. I don't judge it morally one way or the other. And they want prescription rights out of the profession. Which is the thing that helps around the world with acceptance.
Yeah.
Directly.
Kind of defeats the
purpose. Are you on my
purpose.
level? Can you write a script and Costco pharmacy will fill it? Yes. Oh, okay. Well, then they know where we are, like on the totem pole, and that matters.
So homeopathy
Never had one
is.
ask me, like, do you do homeopathy? Yes. Well, screw you.
Yeah,
Never
well,
had
he
anybody
said.
say that to me.
They're still
Prescribe?
young.
Yeah. Oh, okay. Well, then you're good to practice here in Haiti or whatever.
Okay.
So anyway.
So homeopathy is just, I just looked it up, and the first thing that come up is just pseudoscientific.
Yeah, God.
Yeah.
I mean, everything that all of us do is until proven otherwise, right?
Yeah.
So,
Can only be falsified.
yeah, like Google's not favorable to
Yeah.
the SEO of skeptic pages. Steers a lot of people away from naturopathic medicine, but it's not fair representation. It's its own system. Like, I'll just say, learn about it. Don't make any hard decisions on what you're definitely doing or not doing. Honestly, till you graduate.
Yeah.
Again, a lot of students like get, there's a heavy personality at SCNM or something, and start steering a bunch of students somewhere before they've even had any clinical experience, much less been on their own, able to make their own decisions to really see how these different things interplay. So.
So is this like a bigger switch that you're seeing like recently with the whole attack on the homeopathy stuff, or is it just Just out of curiosity.
It's been there, but there's just another wave of it.
This comes in spurts.
Yeah, I mean, I don't disagree with all their reasoning. I don't use a ton of homeopathy. Like, I wouldn't super miss it. There's definitely some cases that I don't know what I would do if I didn't have it. I wouldn't want to remove access to a therapy for my patients. But yeah,
Okay.
a lot to say.
I love stuff like this. This is just, yeah, just hearing different opinions.
Well, yeah, there's like the politics, and then there's also like looking at the history of things. You have to throw away the baby with the bathwater.
Yeah. Yeah, it's also interesting. Like, I know as I've gotten older and as I've gotten more into like medical related things, how hardly tied down everything is just by certain political affiliations and how it's just kind of labeled as one or the other. That's always been interesting to me. Which I wish I didn't find it interesting because that's something that kind of keeps me up thinking sometimes, but it is very interesting to think about.
Yeah, well, and within a larger capitalistic system or larger power struggle kind of system in the world, you always kind of wonder if someone is, because of affiliation or otherwise, if someone kind of pulling the strings on a fight. Like, if I'm making an argument, has it been influenced purely, or has it been influenced by some actors who have some bone to pick with something?
Yeah.
So, hence, like, why I say I'd like students to kind of be mature in their practices before making hard decisions on therapies, because you might just be carrying someone else's angst
Yeah.
forward. But likewise, there's also, totally in Dr. Christensen's defense, there's a ton of bullshit out there too. Like, just saying, that I'm kind of a light supporter of homeopathy. There's plenty of things that I think are just complete garbage.
Oh, yeah.
That some are just money scams, some make zero sense.
Mm-hmm.
Probably, and they would argue also, like, homeopathy maybe doesn't work beyond placebo. It's pretty fantastic placebo if that's the case. Like, it's a pretty elaborate system to get there. So, yeah, I don't know. I'm still expanding my view of how things work as science and experience changes and stuff. But there's some stuff that's going to take extraordinary claims are going to require more extraordinary evidence to make me believe that something works, or that it's worth doing, or worth the price, or the complexity.
Okay. Very cool. All right.
So I kind of answered like 4.
Yeah,
Just in a row, like diagnosis, prevention, treatment.
And the society one was pretty much
enough about each of them for you to speak to them.
I don't think I need anything like direct, like any sort of exact.
Yeah. Okay, so to get a little more specifics, you have a little more meat for some of these things, like so like methods of diagnosis differing between NDs and MDs, for instance. In some ways, they're the same. I order labs, I order imaging, I do physical exams. I do them to a much bigger depth than MDs. So we don't own Dr. Bates, who came up with so much of this physical assessment stuff. but we do a lot more of it because we're not just relying on the imaging.
Hmm.
And the lab work per se, we take a much more thorough history. That's a method of diagnosis. We're trying to look for kind of the initial event that started the ball rolling for chronic disease versus just, okay, but right now which enzyme do I block?
Yeah.
Um, so we're kind of, I would say we do a better job looking at the timelines of illness and wellness, and look at how we can kind of roll back the clock, and how much we can get tissues to heal rather than how do we just relieve symptoms.
Mm-hmm.
So there, other methods of diagnosis. We do employ chiropractic diagnostic methods for spinal analysis. The two Canadian schools, NS and M, do teach acupuncture and Chinese medicine, so we can do pulse diagnosis. We look at food sensitivities through diet diaries. Sometimes food sensitivity panels, which I think are a mixed bag. We usually more tightly interpret labs, or we interpret them a little more the interplay of different components of lab work, instead of just something frankly high or low on labs. So yeah, in a sense, we're looking for more deeper into emotions, I would say.
Okay. So looking at the whole part more so than just diagnosing symptoms, pretty much.
Yeah. More specifically with diagnosis, I think we tend to make more functional diagnoses. So, there's criteria for how do you say someone has pneumonia or not, or has asthma, or major depressive disorder, for instance. So there's kind of like the book, or something says you need a chest X-ray for pneumonia diagnosis. You can't just look at the person. You can't just listen to the lungs. So there's a box, but then we are looking at what's beyond the box. Why does this person keep getting pneumonia?
Mm-hmm.
You shouldn't just get pneumonia randomly. What's wrong?
Yeah, something's up there.
It's a particularly virulent bug. Some are more than others. Some, like COVID, can absolutely take down a healthy person.
Mm-hmm.
Absolutely. Or is this a sign of something larger?
Okay.
So we'll make more. Yes, your diagnosis is fatigue due to chronic stress that's affecting X, Y, Z, versus fatigue to an MD if it's not anemia or hypothyroidism. They're kind of like, I don't know.
It's like
So
something.
we have more kind of outside the box functional diagnoses, and therefore our prevention methods are different. Largely, MD their view of preventative interventions are actually misnomers. They're screening. So it's about keeping something from getting worse, not preventing something from happening.
In the first place. Okay.
At 40, start getting mammogram. It doesn't prevent anything. It prevents you from getting a late cancer diagnosis, but it doesn't stop the cancer.
Mm-hmm.
The exception to this is a colonoscopy, because they're actually clipping precancerous lesions. So it's literally preventing cancer, but that's like the only one like that. MDs want everybody to eat well and exercise and stuff. None of them are like, this is not at all helpful.
Yeah.
They might not agree that those things will change the course of whatever disease they're dealing with. Like gastroenterologists saying, no sense changing your diet because what you eat has nothing to do with your GI ailment, which is mind-blowingly stupid to me. But we are largely, I think, naturopathic medicine as a preventative profession. I'm a heretic with this, like Mona Morstein. I can count on one hand the number of people who've come to me for prevention.
Yeah.
No, they come because they're sick,
Yep.
or they're in pain, or their mind is not well, or something, recovering from surgery or something. And
Never
you get
so.
them better. And in the meanwhile, you are preventing, you're changing the risk of heart disease. You are keeping their condition from getting worse, preventing re-injury, sure. But it's not the primary thing we're doing. And I think it's, sometimes people say holistic, alternative, preventive medicine. Like, preventing this is not what brings people into me. It's not my primary thing. I'm trying to get them better.
Okay. Because I,
The
yeah.
level of detail differs.
Yeah, I've never thought of that. Just kind of going and being like, just, would it just be because there's, I don't know. I've never thought about that before, but it makes a lot of sense. Just people just not going, just being like, I just want to prevent this or something like that.
Rarely.
So like what
They
kind of,
exist, but they're not going to keep you in practice.
Yeah.
Nobody's like, tell me how to eat more broccoli so I don't get cancer. Like, there are some people who's like, oh, yeah, my mom and grandmother both had breast cancer diagnoses at like 40. Can I not get that? Yeah, but virtually everyone who says that also has something going on. So, like, by the time you're 36 like me, you have something going. Maybe, you know, just harder to get up in the morning,
yeah.
stiffness, whatever. Maybe you don't have a major disease, but like, got some bumps and bruises, and things aren't going like they used to. Like, you've got things that you want to fix, not just things you want to prevent. Yeah, soapbox.
okay.
A lot of soapboxes.
Yeah. I ended up wanting to do, just go in this general field because, I probably should have mentioned this, but, when I was a kid, I think I was probably like 12 or somewhere around there, my mom was pregnant with my little sister at the time. And then she was diagnosed with pulmonary embolisms while pregnant. Yeah. She's all right now. She's nagging me right as we speak, so she's alive. But it's just after all the medications and all, because she was on, can't remember the name of the medication, but she had to get blood thinner, like, injected into her legs. Lovenox? Is that what that is? Yeah. It was like twice a day. She did it for a year and a half, I think. But it was just the after effect of all that. And then after that, she had like asthmatic symptoms and just everything like that. Then she started kind of focusing more on diet stuff because she is more like sensitive. She always has been touchy with food. She used to have to take a hit of an inhaler like every time before we'd go to work, because we're dog groomers. That's just kind of in our like name. It's very physical stuff, and she always had to have it on her. And she started taking out grains and like processed sugars and all that, and she hasn't really had issues since, unless it's like super humid.
That's the type of prevention I'm talking about.
Yeah.
Like, prevent your asthma from getting worse. How to turn back the clock. Like, why is it there? Why is your immune system hyperactive? Is it just airborne? Usually not.
Usually not.
By the way, please protect her from getting COVID.
Yeah. Yeah. She already had it like last month, I think. And she was down and out for a while, but she's all right now.
Okay.
She keeps coming back, unfortunately, but
Wait, what?
she's all right.
Still kicking.
Unfortunately.
Yeah, I put all my COVID patients on aspirin. Because we've known, honestly, since March 2020, that most people with COVID clot.
Yes.
That's why the O2 sats dip. That's why they feel short of breath. It's not the airways. It's the gas exchange. They're literally microclotting throughout the lungs. So even asymptomatic people have about the same rate of ground glass opacities on CT as severely sick people. It's crazy. The breadth of damage that the virus causes. So clotting disorders is my number one. Like, please stay in a bubble.
Yeah.
Please don't get sick.
Just stay in a box or
My
something.
dad had a DVT and non-COVID related in November 2020, almost died.
Mm-hmm.
And they had another one related to like a severe body trauma. But he's been on warfarin for a year and a half and probably will still be. So my brother had venous cavernous sinus thrombosis. Like, there's kind of a venous system in your nose that is really close to your brain. He had this black spot in his vision. Didn't really know anything about it. Went to see the eye doctor, and they're like, ER right now.
Yeah.
Right now. So he had a massive clot, pretty much like inside of his nose, extending to part of his brain. And, I mean, he was okay, but he's been on blood thinners.
Okay. So how long is he to be on blood thinners? Is he still on them, or?
I think because they ran the battery of testing, because then you start looking for genetic factors like Leiden-5, which is a cause of pregnancy clots. Different clotting disorders and stuff. If you rule that out, you're like, well, he had a sinus infection, so it's probably kind of a freak thing that that was part of the immune response to it. It's not likely to happen again. Maybe just clamp on antibiotics as soon as you get another sinus infection. But actually, his wife had a DVT. They're like 8 years older than me. They're not like old like my dad, but
Yeah.
I think she is ongoing on blood thinners.
Okay.
Because sometimes you don't know, so it's like it's safer to stay on them if there's a high risk of recurrence.
Yes. So. 'Cause I'm pretty sure for the COVID stuff with my mom, they had her on aspirin. I think that's all they really did.
At least, yeah.
Yeah.
It is associated with better outcomes after I was doing it, because it's just zero risk and a lot of potential benefit. So. Yeah.
Yeah, because I think they wanted her to get back on the Lovenox, which she was very not
Heparin's
willing
pretty
to do.
standard,
Yeah.
I mean, it's temporary though. It's not like forever, but it's like while this virus is making a clot like crazy, let's cut back on that. I'm glad she's doing well.
Yep, she's kicking.
Still kicking. Okay, where are we on that?
Pretty sure we've hit just about everything.
Society understanding this stuff? No.
Yeah. That's what I found out with my
They're
survey.
getting there.
Yeah. It's getting there.
I mean, they're at least getting to the point of kind of knowing what naturopathic medicine is. Even if they just, even in my family, they're like, oh, what's the homeopathic treatment for this? And I know they just mean like naturopathic treatment.
Yeah.
There's still a lot of confusion, but the level of like detail that I answered above, I think even most NPs don't really have a handle on. But no, I think people are more and more getting like there's more to life than the conventional system. Conventional docs are too. Like they're not automatons. They're at least as frustrated with the insurance system and how everything works as we are. They're just in it, and we're minus the Pacific Northwest. We're out of it, and we're in the cash system. So, yeah, I mean, they all want their patients to get better. They don't want them to get cancer. They also have, PCPs an average of 7 minutes with their patients. Like, none of them like that. None of them are like, this is the best. And more, especially the younger generation, are supportive, if not trying to learn integrative therapies. That's what I see, and that's what I focus on. So I'm less concerned about the people Alan Christensen's concerned about, the creaky ones who are like, oh, well, if you believe in homeopathy, that's a rule out. You're full of shit.
Yeah.
Or what those people say, they're going to get old and die. Uh,
They're fine. Yeah.
I'm more focused on building coalition with the younger people.
Yeah.
And that also sets me apart from the vitalists that are very much like we are. They kind of carry the old, the fighting of the old guard that got us here, that got us to independence, that kept us from getting swallowed up, like the osteopaths. But we don't need to carry that on. Like, it's not like every single MD is out to get you.
Mm-hmm.
So I'd rather build my friends than just focus on how different we are.
Mm-hmm.
So I think people are getting it. People are, just through social media, like learning about food sensitivities and learning that even if they go a little faddish, I just shouldn't eat anything with gluten in it, versus like, try gluten-free for a couple weeks, see how you feel.
Yeah.
Like, just start experimenting with stuff. If you feel better, awesome. You might have found something that's causing you inflammation that might not be causing someone else inflammation. So, if it takes a bandwagon to get there, then okay.
Mm-hmm.
Progress is noisy sometimes.
Oh yeah.
So,
it's hard to sometimes weed things out because you can kind of rely on common sense most of the time, but yeah, it's always good to test stuff, of course.
Yeah. Never know. Need application of either medicine dependent on the injury or ailment. Yeah. And so the cool thing about naturopathic medicine, how much have you studied, like, background of, like, I don't know what else SCNM has done to be like, here's naturopathic medicine, aside from the smoothie thing with
Yeah.
Global Health Talks. The Fringe.
Yep.
Do they teach you, like, the therapeutic order?
We kind of went over like just the general rules of naturopathy. What is it? Is it
Oh, like the 6 principles?
6, yeah.
None of which are unique.
Mm-hmm. Yeah.
Every MD would agree with those things.
That's...
And say that they do them. But again, the degree, like healing power of nature, yeah, every MD knows that the body's a self-healing thing.
Mm-hmm.
They just go about that differently, right? They all think they're educating their patients. They think they're doing prevention. They think first do no harm, like from the Hippocratic Oath.
It's like good, like
so ironically, the things that we kind of like put on literally the flagpoles in the hallways, like are like the least kind of defining characteristics of us.
Yeah.
I will preface this. I kind of hinted at like the racial reckoning in the profession. So the author of the therapeutic order, I will just say is a white supremacist.
Mm-hmm.
At a court of the profession, that would not be a controversial thing to say. They would agree, but the vitalists.
What are vitalists?
Racist grandpa, can't criticize him. Like,
yep.
I can, and I can also acknowledge his benefits to the profession. So let me, Jared Zeff, see what I'm talking about.
Okay. What are vitalists? Are they just, is it just like basic, or could you go a little bit into detail about that?
In the Alliance, we would say that. And yeah, the modern view of the term basic.
Yeah.
No, they're, they think they're the old guard. They think they're representing, the naturopaths of 100 years ago. The roots, the philosophy, not deviating from it, but really it kind of leads to dogmatism.
Mm-hmm. Because
they're not actually practicing this therapeutic order. I'm going to use this best year. Oh gosh, I'll be a competitor here. I'm not at all married to any of the schools, by the way. I did the smoothie social thing because we like talking to prospective students and stuff, but I left SCNM. All the schools have really good things and they all have problems. All the students complain about the same stuff.
Yeah.
They transfer thinking things are like different or better, and they're not.
Yeah.
Like, just pick the one you want to go to. That's it. Don't get too crazy about it.
And just stick with
Okay,
that,
so
yeah.
here's therapeutic order.
Okay.
And honestly, their admissions departments all get along. The schools all get along pretty well. So.
Okay.
See if that pops up.
Okay.
So this is my unifying answer to the question of naturopathic, or maybe least invasive to most invasive, or comparing and contrasting these things. Quote, allopathic medicine is a part of naturopathic medicine.
Mm-hmm.
We will use this exact same interventions at totally different times with a patient. And I might not literally do all these interventions. They're not even my scope or training. But a gunshot victim is going on an ambulance to get trauma surgery. That's like that. We all agree on. The vitalists would agree on that. Some of them might try to
Just put some sage on it, it'll be
comfrey
fine.
or something stupid on there, but like we all agree, there are some limits to our purview. And likewise, the conventional system all struggles with the base of this pyramid. And all of their problem patients, all their cases that they would like pawn off on us are because the things at the base of this pyramid are not being done. Or they've fallen apart, the person's already beyond that. They're already in late stage organ failure, chronic disease, and you have to intervene harder to get them better. So, but this literally, I refer patients to surgery. I would love if they weren't so bad that I could PRP them and get their shoulder healed up.
Mm-hmm.
And most people coming in, yes, but some come in and things are woefully unstable. We don't work absolute miracles. We can't get ligaments that are completely ruptured and flapping in the wind to just. That's literally what surgery is. Sticking things back together, cutting things that are not supposed to be together, and fixing structural stuff. Sometimes that's what takes. Cleft palate surgeries around the world for kids with cleft palate. Like, I can't fix that. I could have prevented it maybe earlier with some good folate. Early in pregnancy, by the time women know they're pregnant, it's too late to fix neural tube defects.
Mm-hmm.
But yeah, fix the cleft palate. Good. I'll help you heal faster from surgery. But yeah, so there's an order that we approach things. It depends on degree of pathology, patient's access to these things. Finances enters into this pyramid.
Okay.
But I would say that allopathic medicine doesn't necessarily comprise naturopathic medicine. Definitely doesn't. But they do. Their methods are not incompatible with our system of medicine. We just encompass a lot more.
Okay. It's more broad rather than just focusing on just that aspect.
Right.
Okay.
Right. And we need them. We need those specialists. I'm not a surgeon. I'm not that interested in it.
Yeah.
But my patients sometimes need specialist workup. They need, like I need to go get an echocardiogram. I don't know. There's no ND that will knock me out, shove a ultrasound probe down my throat.
Mm.
And I want someone who looks at hearts all the time.
Yeah.
To look at my heart, and not like a generalist who
Just kind of
does
dabbles
this
in it.
every few weeks.
Yeah.
Like detailed problems. Sometimes you need a really detailed, focused person. You also need someone to zoom out and look at the entire picture, blah, blah, blah. But sometimes that person doesn't have the detail to diagnose more advanced things. So it takes all of us.
It's a big system, yeah. This is a really interesting graph here. So like high force interventions, what would that be considered?
Drug surgery, mostly.
Okay.
So this is kind of like a, most invasive to least invasive. Synthetic symptom relief, meaning, um, ibuprofen for your headache. High force intervention for severe pathology would be like IV antibiotics for sepsis, right?
Mm-hmm.
Like, actually curative, right? Just, I would have liked someone not to get sepsis in the first place, but here we are. The IV antibiotics are your best option. Could we, in another universe where we didn't have them, could we, do herbs and stuff? Yeah, it's not going to be as successful. We could do both. I would love if hospitals could do both, but we've got to have the antibiotics. Go for it. That's naturopathic. That's where you are in your pathology. You're dying of sepsis. You need a strong intervention. Natural symptom control. This is what we call like green allopathy. So this is like as far down as MDs get when they're learning functional medicine stuff. They're like, oh, okay, so instead of Prozac, you're just giving me St. John's wort for depression. I got it. No, that's the issue that we have with the term alternative medicine, which is like, oh, I just need an alternative pill for this condition, or that the medicine itself is just an alternative to conventional medicine. And no, because we're going to look at the factors that led to this person being depressed. Genetics, childhood trauma, current cognitive distortions, behaviors, biochemistry, through nutrients, etc. I might end up giving St. John's wort in the end, but it wasn't because I just one for one. This is the herbal version of an SSRI.
Mm-hmm.
It's a pretty specific depression pattern that Hypericum perforatum is good for.
Okay.
So, but there are times when it's like, say, just go back to like the injury thing. You busted your shoulder up, had to get surgery, and some ongoing pain with it. You won't go back to how you were pre-surgery. If you got implants and stuff, like you'll never go back there. Can we get you as well as you can be? I'd rather do that with a less harmful, say herbal intervention or physical therapy or something than I would a med. So, it's harm reduction, but understanding that some things you won't be able to heal all the way. Diabetes.
Mm-hmm.
By the time someone needs insulin, their C-peptide's bottomed out, they have no pancreatic reserve, they will not produce enough insulin to live without additional intervention. They will never be med-free by the time they're severely insulin dependent. That's okay. Like, that's why we have some of those meds. We might be able to get them off of insulin. Maybe not. But I can help them function as well as they can through, natural and, honestly, everything is natural. Everything's in the universe, but synthetic versus natural products, right? Physical alignment. I actually argue that this is not necessarily, and even Dr. Zeff says this is not gospel. This is not intended to be the end-all be-all. It's a model for looking at things. But if you have poor posture, and that's what's throwing your shoulder off,
That's me.
like every college student, every med student, every doc who's then looking down at a computer.
It's banana shaped constantly.
Right. So physical alignment, I would say, is in the foundation for health. Honestly, fixing posture, manipulation, that kind of stuff. Now, I think what's intended in this part of the pyramid is, if you have chronic pain and we're just, like a chiropractor giving you adjustments 3 times a week forever, you're really, really fixing things. I mean, it's better than harmful meds, sure. Maybe better than just popping, herbs all the time. So I would distinguish like corrective things versus palliatives, physical alignment stuff. But I do all kinds of phys med for visceral things, soft tissue work, and oftentimes I get more mileage out of that than I do for the prescription pad or the tinctures and stuff. Supporting weakened systems is kind of tonifying parts of the body, um, like the recurring pneumonia patient, right? Why do you keep getting pneumonia? Tonify your lungs, natural killer cells, that kind of stuff. So Wei Qi in Chinese medicine to like protect you from getting sick in the first place, um, and to have a more quick, robust response to a pathogen so it doesn't roll into pneumonia next time, right? It's like strengthening systems, stimulating self-healing mechanisms. So these kind of like what I call the spark plug therapies or the VIS therapies, like homeopathy.
Yeah.
Or acupuncture, or I don't know if you've ever sat down with like maybe it's a physician or a therapist or a wise elder or something who's, through conversation has like lit something in you. Like however you found out about naturopathic medicine, like something that just kind of sparks a change in your life or in your body or whatever it is. To me, these are all the same. Just different ways of achieving the same thing, just a shift, kind of shake the system, hit the reset button. And in terms of health, like if you're not giving your body the building blocks it needs to make healthy neurotransmitters and to balance inflammation and stuff, like good luck. You can get away with it when you're maybe a kid, early 20s, those invincible people who think COVID won't hurt them.
Oh yeah, I know the type.
Like, yeah, true for most, absolutely. But also, like 1 in 5 will get a persistent symptom.
Yeah.
The more infections you have, the more you roll that dice, and eventually things will break down. Eventually, unless you're the rare 95-year-old guy who smokes like a chimney and ate bacon his whole life.
Yeah.
Like, the exception rather than the rule. Like this will catch up to you. You will accumulate damage throughout your life. So, does fixing the bottom of the period necessarily fix everything else? No. But if you don't, good luck fixing everything else, right?
Yeah.
Good luck continuing to eat shit trying to prevent pneumonia.
Mm-hmm. So that's how my grandfather, he's got a lot of issues, but he ended up having a stroke, and then he found out, I think it was during, I don't remember what it was, but he was eventually diagnosed with I think it was like mid-stage colon cancer or something like that. So because of that, he found out, because I've always kind of given him shit for eating just kind of like a toddler. Yeah. And he's starting to do better now that he's aware of stuff, but still, it's just, it should be basic knowledge, but sometimes they just choose not to listen. Yeah.
Well, again, part of, I guess, as kind of a thought experiment, I think there's this interesting thought that kind of speaks to, like, it's not uniquely the American condition, but there's a question of, if you're looking at a system where there's like an oppressor and an oppressed side, like let's say feminism, for instance, does the patriarchy also harm men? Yeah. Yes, it does. Not most of it. Not trying to like shift the focus off, but like there is actually a selfish gain if you're on like a dominant side or an oppressive side of something to change it. And part of it is that there are things that you don't have to worry about as a cis man in society, but there are also additional things that come with that entire system that you don't want, that you didn't start, but you benefit from, and you are also weighed down by. So you gotta be this beefy, hyper-masculine dude.
Yep.
You can't have emotions, can't show emotions. That's bad for everybody.
Yeah.
It's a tight box for you too. So if we all fight this to change it, everybody gains for different reasons. So I think it's I think that level of understanding also helps us like see the humanity our conventional colleagues more. Like I've said, I think they're kind of somewhat personally demonized by like the vitalist, wing of the profession. But I don't know. There's just a lot of frustrating. You would think that it should just be common knowledge that if you eat better, you're gonna have an easier go with your health. Why isn't that in our society? But it's in traditional societies around the world. It's the cultural genocide I was talking about.
Yeah.
Like, our society is kind of defined by not having a culture, like not having a structure to it, by lacking history, by suppressing its history. And so we are missing all the wisdom of the indigenous people of the United States and peoples around the world. And now that MDs are like, oh gosh, we have this study showing if you eat better, then you'll be more well. Like, that's evidence-based, that's science. And everyone else rolls their eyes. Like,
it's like, yeah, no shit.
Like, how much did we have to spend for someone to say that definitively?
That's America for you.
So, everybody's at a different point along the journey with this whole thing, and if it took getting colon cancer for your grandfather to make changes, like gosh, yeah, that's the prevention thing. Like, I wish I could have seen him when he was 15, but hey, he's halfway up the pyramid, better now than never, right? He can somewhat turn back the clock on his health, on the weight of things that have aged him. Not all the way, he can't become a 15-year-old, but maybe more like he was 65. If he does some of the right stuff, like, that's something to fight for. So.
'Cause he definitely looks younger than what his birthday was, his birthday was yesterday. I think he's like 72 from what he said. I thought he was in his early 60s. I mean, he's looking all right. Yeah. For eating just TV dinners and lunch meat his whole life. Salami and cheese. That's his go-to. Yeah. Grandma and Grandpa's house is never fun. Yeah. We either get fed like rabbits or
it's like when you were a kid.
Yeah. Yeah.
Processed meats.
Yeah. My sister and I thought it was the best thing when we were kids. I don't remember why. He used to call them picnics. But it was like a handful of raisins, like a slice of cheese cut up in like a triangle, like a cracker, like applesauce. We thought that was the coolest shit for no reason. And now I look at it and like, maybe that's why my just percentile is like 12.
That sounds like, Great Depression, baby boomer era, what you had to do to survive back then.
Yeah.
Interesting.
Yeah. Yeah, then he'll show me pictures of like charcuterie boards or however you pronounce that. He's like, hey, I used to do this. Like, no, you didn't. No, you didn't.
That's charcuterie?
Yeah.
Raisins.
Yeah. He would just cut up the cheeses in different ways, and he thought he was so creative.
In his way.
Yeah. Whatever makes him happy.
Yes. Honestly,
Yeah.
yes. Because that's all we've got in the end. So.
You cut up pieces of cheese in star shapes and ovals.
And maybe happiness.
It may be happiness. The cheese comes along with the happiness.
That is true. Certifiably true.
Ditto on that.
So on that note, I hope that answered everything. I have to run because a rep is trying to sell me something, although this time I actually want it. I did ultrasound guided injection training with actually some of my former students who are now the masters.
Ooh,
That's
cool.
my ultimate goal. Teach you all how to make you better than me and then teach me your stuff.
Yeah.
So we're going to buy an ultrasound probe.
Oh, very cool.
Like guided injections.
Okay.
See what he's got for me.
Very, very cool. Awesome.
Yeah, keep in touch, and I'll send Dr. Watts a message. I'm pretty sure she's still taking shadows.
Okay.
We all kind of make it a priority because it matters,
Mm-hmm.
and better informed students going in and know what they're going into also, because you've got other options, PAs, other ways to go also that that's changing all the time too. So make sure you really want to do this.
Yep. Is she part
She's
of
fantastic.
Cleveland Clinic? Is that because I heard that a new branch opened up in Cleveland for naturopathic?
No, she's private practice. It's
Okay.
Her practice is called Toledo Naturopathic.
Toledo naturopathic. Get that.
Oh, new website coming soon. Well, you can email her, whatever. But I'll drop her a message too.
Okay.
Or I can. I think I still have an email for her. I could just email introduce you. But
Okay.
I would absolutely, and also for an ND and unlicensed state who is wildly successful in business, that's not the most common combo.
Yeah, take advantage
That's
of
who you
it.
want to schedule with. And comprehensive, she hasn't sold her soul, to do just weight loss clinic or something like that.
Yeah.
She sees everything. She practices more like an old school ND.
Okay. So Malia Watts, you said?
Yeah. That's her professional name.
Okay.
Still Toledo Naturopathic.
Because I have a job set up next semester as a medical scribe.
Good experience.
Yeah.
Nice.
Yeah. Just with all the COVID stuff that kind of fell through this semester because I was just like, I don't really want to deal with COVID at my doorstep, especially living in a dorm. Yeah.
I hear you.
Yeah.
All right, well, enjoy. And, we'll touch base soon.
Okay, thank you so much for this. I really, really, really appreciate it.
Of course, yeah. Write a kick-ass paper.
Will do.
Teach a professor what Eastern medicine actually is.
Yep.
If you don't get it, then you're the audience for the paper, right?
Yeah.
Good job, professor.
It's like, good job.
You're making it incorrect, so I can understand it.
Yeah, thanks so much again. This has been a major, major help. It was awesome talking to you. It was awesome getting information, and I really want to hear from Dr. Watts because I am looking for pretty much anything I can at this point. Just kind of any sort of help I can get.
Yep. I'll send a message.
Okay. All right. Well, have a nice
Alrighty.
day.
You too.
All right.
Bye-bye.
Bye.